What are the social factors that increase TB risk? Tuberculosis can seem like a distant concern, but social factors play a big role in who gets infected and who develops active disease. These factors influence how likely someone is to come into contact with the bacteria and how well their body can fight it off. Living or working in crowded places like homeless shelters, prisons, detention centers, or long-term care facilities significantly raises the risk. These environments have shared air spaces where TB bacteria can spread easily from person to person. People experiencing homelessness often live in crowded shelters or in stable housing with poor ventilation, making exposure more likely. Plus, they might face barriers to health care, which delays diagnosis and treatment, increasing the chance of spreading the infection. Substance use is another important factor. Excessive alcohol consumption and non-injecting drug use weaken the immune system, making it harder for the body to fight TB bacteria. Substance use is often linked with social marginalization, poor nutrition, and unstable living conditions, all of which increase vulnerability. Tobacco smoking also plays a role. Smoking damages lung defenses, impairing the body's ability to clear bacteria and making infection more likely. Even exposure to secondhand smoke can increase the risk of TB infection and disease. Certain jobs can increase risk too. Healthcare workers, for example, may come into contact with infectious patients, especially if infection control measures are not strictly followed. However, social factors like homelessness or crowded living are generally more significant than occupational exposure alone. Socioeconomic disadvantages such as poverty, food insecurity, and limited access to healthcare are major contributors. These issues not only increase exposure but also delay diagnosis and treatment, allowing TB to spread more easily. Vulnerable groups, including racial and ethnic minorities, often face these social challenges, which heighten their risk. Geography matters as well. People born in or frequently traveling to countries with high TB prevalence are at greater risk of exposure. Within countries, TB rates tend to be higher in regions with poorer social and economic conditions. It's important to remember that these social factors often interact with medical risks like HIV infection or diabetes, which further weaken the immune system. Addressing these social determinants is key to controlling TB. Public health efforts that focus on improving living conditions, reducing homelessness, tackling substance use, and addressing social inequalities can make a big difference in reducing TB transmission and helping those most at risk. Always consult healthcare professionals for personalized advice and treatment options.